Hey everyone, thanks for tuning in. I'm going to talk just a little bit about cervical joint motion, and we're going to reduce some of the motions down and try to understand what's happening. And really what I'm talking about is reducing the cervical motions and the understanding of them to a coupled motion, which is a rotational motion, and a translational motion. So there's really two types of motions. So what we consider, say, lateral flexion and rotation, we know that those motions in reality are coupling. They have to work together because of the angle of zygapophyseal joints. One zygapophyseal joint has to slide up as the other slides down, and that's going to create an axis of rotation, but at the same time lateral flexion. So lateral flexion and rotation are very much joined. So just in this basic thing here, we usually think of rotation happening this way, lateral flexion happening this way. And flexion and extension. Flexion and extension is kind of like another type of lateral flexion as well, but there's a little bit of a different. If we're just looking at pure flexion and extension, it is a little bit different. There's some translation there as well. So I'm just going to break down how this works on a spine. So here I have C5 and I have C6. So this is a C5 and this is a C6. So I'm just going to look at this zygapophyseal joint here. So I'm just going to look at this articulation. And we know that if we try to just simply rotate it, if we assume that the axis of rotation is here, which all of us that had models of the spine had the little pole going through here, and we imagined that it was just rotating around that. And even when we're grabbing onto the joint, we're trying to rotate the joint that way. That's not the way the joint is meant to work. So we can see here that the zygapophyseal joint goes at an angle like this, and quite a steep angle, so that if we were to try to rotate like that, we're just going to be jamming that facet joint together. So it can't work that way. It has to have some aspect of glide, which means that it's going to pivot like this at a different angle. So the axis of rotation has to be more like this. It's going to be 90 degrees to that joint because this articular surface is meant to slide. So the axis of rotation is actually happening back here. So when we rotate the spine, we also have to have a degree of lateral flexion as well. So we get this sort of motion like this. So as one facet joint goes up, the other comes down, okay? And that's what combines that rotation with the lateral flexion. Now, there's another motion that happens when both zygapophyseal joints move in the same way. Then what's going to happen is we're going to have, in flexion and extension, we have this sort of glide where they both move at the same time. They glide like this, okay? So in pure flexion and extension, we have this gliding motion, okay, apophyseal glide. But we also have an apophyseal glide that goes at an angle from one side like this to the other side like this. It slides this way, okay? So they both go up at an angle, or they both go at an angle this way. So they can slide like that over each other. And this is a very, very important but massively overlooked motion. If both joints go like this or both joints go like that, that's another type of apophyseal glide. That's really, really important in the joint function because particularly when we're walking, we're not just walking with flexion and extension and with rotation. There's actually a shunting force at heel strike that drives the body forward at an angle. So the joints have to respond to that force, which is is basically kind of shunting one joint underneath another joint like this. So as you have a heel strike, your body has this need to stop and slow that force down. So you're basically pushing yourself forward, your body is falling, you're hitting the ground with your heel, and that force is being absorbed through your joints and going into your spine, and your body is going to basically absorb that force of absorbing gravity and stopping your body from falling down. You're going to sense that force and respond with a muscle contraction to slow that shearing force, that vector of force, and then respond with the appropriate amount of muscle contraction to stabilize the joint. And then what's going to happen is once that force finishes, essentially, you're going to be in the standing phase of motion, and then your body's going to rotate as you throw the other leg forward and take another step. So there's really two types of motions that we need to look at. One is that rotational component where one zygapophyseal goes down like this and the other one goes up, where they're going essentially opposite to each other. So you're creating an axis of rotation, which is allowing for rotation and lateral flexion at the same time. And then we have that shearing force that can happen through flexion extension or at angles off flexion extension that are going to allow your body, particularly at heel strike, to absorb that force. Now, when we have a problem in the joint, one of the most common things that happens is we're not managing that. So I find that being able to assess that translational function of the spine and its ability to absorb that force and respond to the force and maintain stability of the joint is the most important thing. If we can't manage that shearing stress, then we're going to end up with a pattern of muscle contraction, which is going to affect that coupling motion as well. So very often we see a coupled motion issue, but it might be due to a translational stress error. In other words, you can't manage a translational stress. So I've put many videos on my YouTube account where you can watch this. Also, I have a channel on Facebook for Adjusting to Neutral, where I give a lot more detail about how that works. So if anyone's interested in hearing more about that, I've already put tons of information together about it. But I just want to give you a little bit of an idea of breaking the joint motions down into rotational motions, okay, or translational motions. We often don't look at those translational motions effectively. We don't assess them effectively. I was certainly never taught this very well in school. There was some alluding to it, but it was never really very, very clear. Some techniques, SOT has that with that cervical stair stepping kind of thing, and then there's like the snags. They pay attention to the apophyseal glide. There's a few other different techniques that do pay some attention to apophyseal glide, but that translational glide is super, super important. So I've certainly found that in my practice, by resolving those translational components, that the coupling motion just immediately picks up very, very quickly, and that the joint is much more stable. So it's definitely something that I would recommend looking more at. And like I said, I've put a lot of resource up there if anyone wants to watch it. I don't get anything out of this. I'm not selling anything. If you have questions or comments, please fire them out. Critiques as well. I'm open to everything. So just tell me what you think, have a look, and look forward to seeing you in another video. Thanks for watching.